Awesome. So, Dr. Allison,
Nurse Jen.
let's chat about perimenopause and why
Let,
we're doing this live today.
let's do that. I am really excited to have this conversation with you and share it with people because we talk about this together all the time
Yes.
and what we're seeing with our clients and our own selves and what's working and what's not working.
Yeah.
And I think it's really important that people have the opportunity to ask us questions and share what they're going through. And this is really why we're doing it live.
Yeah.
And we'll share this on our podcast and like get the word out and everything that way too. But here we are. So, um, I think I had our list of questions, so I think I'm just gonna shoot them at you and we'll
Oh,
chat. And
sure.
um, so our first question is, what are you hearing from women when they first come to you about perimenopause? Like, what's the most common thing that you're hearing people say?
Yeah. Like, what the hell's going on? Like, what is
Right.
going on in my body? Why do I feel this way? I think women are still confused, even with as much information that's out there on social media. I think that's adding to the confusion, right? We know, okay, now we know that perimenopause is a thing. Why was I not prepared for this? Is this perimenopause? Is it not? Because we tend to blame everything on it, right? So I think that it's just a lot of confusion in general, and they just want to feel a normal. They want to feel like, okay, yes, I'm normal. So you're just helping them understand that this is not something you did wrong. This is your biology. This is happening, and there's options out there. You don't have to feel this way, right? So let's get you feeling better. So I think that tends to be kind of the initial confusion. Oh my God, what is this? Why is this? All of the above.
And I think it's also part of like that medical gaslighting, like, oh, my hair is falling out and I have this brain fog and everything's cold and then everything's hot. And it's easier just to say, oh, that's peri. It'll be over in a few years. And nobody's even getting their iron panels checked or their thyroid checked anymore. It's like once you hit a certain age, you're just kind of written off.
Yes.
And that's where we get to come in and go, no, we're going to
Yeah.
figure this out together.
Yeah.
So, why do you feel, in your experience, women are so blindsided by perimenopause? Like, why is
Oh,
it such like a, oh my God, it's here?
yeah. So, I mean, nobody talks about it prior to like the last couple of years, right? Even now when I try to talk to siblings, family members, my mother, what have you, it's like it's just really not ever. It's not a topic even to try to get them to say what happened. It happened, or they didn't even know that's what it was, or what have you. I think that because there's so many symptoms and everybody experiences it differently, that people don't even realize that's what's going on until there's something that is like a hot flash, because everybody knows hot flashes, or a
Flashes,
cycle change, or they
right?
gain weight, because that's the number one thing that bugs everyone, right? They're like, oh, I put on weight and I don't want to do this. So I think that it's just, again, like you say, we go and we talk to our providers, and whether it's gaslighting or we have to rule out 50 things first, because there is some safety in that, in at least looking at, like you said, iron or a thyroid or a D, and seeing if that has anything to do with it. But yeah, I just don't think that we've had any education, no preparation. I think that when we go and we get our annual checkup and a
Mhm.
physical, it should be a perimenopause questionnaire once we get to be a certain age. Not that everyone reaches at the same age, but we're getting breast exams at a certain age. You get a colonoscopy at a
Exactly.
certain age. Why are we not starting some type of a questionnaire of, oh, you're exhausted? Oh, you have no sex drive? Your anxiety is worse?
Right.
List the number of symptoms that could come along with it. But I do think that that's what a well woman exam should include. And that would help us a lot, not be so blindsided, to be hearing from the age of 30, this is coming.
Right. Right.
Prepare for it. Yeah.
Yeah. And I think the generation before us, most of them had hysterectomies in their
Yes.
30s. As soon as they were done having children, our mothers had a hysterectomy. And whether it was for heavy bleeding or pain or just whatever, that was just the gold standard. And
Yeah.
so they didn't have necessarily the experiences that women with uteruses are having, because it is a little different. You are
Yeah.
seeing those changes, and that inflammation changes are huge too. And plus, I mean, by the time we hit perimenopause, most women are either have young children or teenagers. Our heads are down. We're grinding through life, like get
Yes.
through work, get through kids' sports, get through the day, get dinner done, do it all over again. And we're not even given the chance to take care of it or notice what's
Yep.
going on.
Yeah. Well,
And
and if your parents didn't have a hysterectomy, they were probably told they couldn't have either put on hormones and taken off or told that they couldn't have them. So
mhm,
again, we're back to, well, we just have to deal with it. So
yeah,
why would we have been prepared for it? It's just, there's nothing we could have done. And that is also a disservice because hormones aren't the only thing that can help here.
right, right. Or birth control, or stay in an IUD
Right.
until you're 55 and
Yes.
hope you're in menopause. You'll probably be in menopause by the time we take you off birth control, so you won't have any symptoms at all.
Oof. Yeah. No.
And that's a big ask on your body.
Yes.
Um, and then I'll say what's the most surprising symptom of perimenopause in my experience is
Hmm.
the itchy ears.
Yeah.
And women, like, I'll be in a class and someone will be like, I'm sorry, I'm itching my ears. It's just so weird. And we're like, oh, babe,
Yeah.
hormones, inflammation.
Absolutely. Yeah,
Mm,
ringing in the ears too. I think that's another one that's like, why is it affecting our ears so much? Who knew that estrogen was a thing in your ears? But, please don't go shoving estrogen cream into your ears.
no,
Like,
no, no.
people are all over like talking. That's another thing on social media. Like, no, don't, like, there is no science behind that. Let's not do that.
Right,
Yeah, I
right.
think that one, and I think that honestly, the mental load that
Mm,
it can cause on some people is super unexpected. And I'm definitely speaking from experience on that one because you don't really always tie it to that. And it just starts to come on, and then it gets a little bit worse, and then it gets a little bit worse, and that can be anxiety, it can be depression, it can be overwhelm, it can be, show up in different ways. But that is why so many women of this age group are on, depression meds, SSRIs, going to therapy. And I think all of those have a place for sure, but
absolutely.
it's not root cause treatment. You may still need it even if you treat the root cause. You
Right.
may still need those things, but let's make sure that we're at least addressing that this is part of it too. Because I do think that when women understand it, there's a little bit less anxiety about the anxiety and a little bit more acceptance of ourselves.
Absolutely. Yeah. And you've talked with therapists on your podcast too
Yeah.
about how ADHD can skyrocket and really
Hmm.
impact cognitive function and brain health function and all of these changes. So it's not just hormones, it's not just the classic symptoms. Like, we're seeing this spread out through the whole body,
Right.
and it's really difficult to manage.
Yes. Very. Yeah.
Yeah.
Yeah. Unless you have the right help.
Unless you have the right help. Exactly.
Yes.
And our last question in this, like, reality of perimenopause is, why does perimenopause look so different for each woman? Why can't we just have one protocol that works for everyone? And I think we see a lot of this with HRT. Like, someone does well on a cream, but someone needs pellets, but this one can do the patch and this one can't do it at all.
Yeah.
And I think that's a really frustrating part of what we're going through in this
Completely.
experience too.
Yeah, yeah, because everybody wants to compare with whatever their friend did or their other somebody they know or whoever's talking about it on social media. And it is 100% different. We're all individual beings. Yes, our bodies are made up of the same organs, but we've all had different traumas, we've all had different insults from toxins, we've all had different paths through life, different hormone treatments. All of that changes how your body manages things. It's just like if somebody stubs their toe, some people will be in a 10 out of 10 pain, some people will be a 1 out of 10 pain. Could have been the same exact thing they stubbed their toe on. So I just think that we're put too much pressure on ourselves. I find this in people when it comes to surgery too, especially in the elderly. Well, so and so had a hip surgery and they did fine. So
Yeah.
hip surgeries must be great. Well, so and so did a hip surgery and they had a horrible time. It must be that physical therapist or that surgeon. It's it's just partly body. It can be, it could be a multitude of things. It's not just the hip surgery. It can be so many different things.
Absolutely. And from a functional medicine perspective, if we go bottom up, if your good bacteria or probiotics are in a different balance, you're going to clear hormones differently. You're not going to move as effectively as someone else might. Then we move
Right.
up to the liver. If you're not clearing hormones through your liver the right way or the way it needs to, or you have too much, then that's going to cause a problem. And then we have like the ovaries. So do you deal with PCOS? Do you have this
Right.
insulin resistance? Have you had children? Do you ovulate regularly? Have you never ovulated regularly? All of those things make a difference, all the way up to stomach, thyroid. How is that impacting your metabolism? Has it always been great? Are you on thyroid meds? All the way to the brain and the hypothalamus, the pituitary. What hormones have they been sending out your
Right.
whole life? Are those cycling correctly? And if they're not, then we have a cascade of other issues. So
Yeah.
it does make it so complicated, and why we're all like trying a million things. Some
Yes.
things are working and some things aren't, because our bodies are so unique
Yeah.
to themselves. And that's really, really hard.
Yeah. And it does add to, like you said, the frustration, and people want it to be, oh, just tell me to take this one thing or do this one thing and it fixes. It is really holistic. It is the
Right.
whole body. One thing, not one exercise, not one pill, not one, supplement or diet change or anything. It's just, unfortunately, it's just not going to work like that. And honestly, it's for the better of our bodies in general, not just perimenopause, right? If we take this as an opportunity to just improve on our health, it will improve our longevity. It'll improve so much. If we take this as an opportunity to just get more frustrated and do nothing, and continue a poor trajectory in our health, then that's what's going to happen. So I really think that this is just a great time to take stock in what are we doing and what are we willing, what kind of lifestyle do we want to have and what kind of things are we willing to do to get that?
Right. Absolutely. So let's talk a little bit about that. That's a great segment, because like
Okay.
what's not working, So what have you seen most women trying before
Mm.
they even come to see you?
So if it's a weight gain issue, for sure, exercising more, cutting calories, which is not going to help the situation here, right?
Absolutely. Yeah.
Um, whatever random supplement they found on Amazon or that their friend was doing, um, that's common. Well, my friend's doing this one and I think I'm going to do that one. What do you think? It's a very common. What do you think about this supplement? I get that all the time. And it's like, well, let's dig into it a lot more. Like, what are you trying to do? Is that, what's in there actually going to help with that? And it might have worked, might or might not work. Supplements are great when they're done right. But they don't work for everybody. Again, same as what we were saying. It's so individualized. Um, but yeah, they're commonly trying all the things that used to work and now
Absolutely.
they don't. And I always tell people I feel like that's kind of like your first indicator. I used to sleep 6 hours a day, and now I can't. If I sleep eight, I can't even get eight in and still feel good. Okay.
Right.
Or I used to sleep six and six isn't enough. I used to intermittent fast, and now I just feel horrible on it. I used to. And those things don't work. And that's a really hard thing for people to grasp because we just spent 40 years figuring out our body and possibly finding what worked finally, right?
Yeah, right in time for it all to change.
Yes,
Yeah,
exactly. Yeah.
absolutely.
Yeah.
I see the same thing where people fill out my intake form and their supplement is this long. And I've always asked, like, what have you taken in the past? So that way I have
Hmm.
a good idea of what they've already tried. And that list can be just as long. And I'll be honest, I'm guilty. Like, if you looked in my pantry, you'd be like, Allison, what's with all the supplements? I'm
Yeah.
like, I'm willing to try things,
Yeah.
and I
Same.
know why I'm trying them. But if you don't have that education, that knowledge base, and you're just pulling things, and I'll say, there's so many companies out there right now that are able to sell low dose estrogen and progesterone creams.
Yep.
And then they're selling testosterone creams. And people are just buying this. And my clients
Hmm.
message me, they're like, hey doc, like, should I try this testosterone cream? I'm like, there's no testosterone in it, because legally we can't get that over the counter.
Right.
And you're just putting more junk in your body. And a lot of women, especially with mast cell activation, autoimmunity, they're trying creams and making them worse. It's
Yeah.
activating the immune system. So it's really hard when you do this alone and you're
Yeah.
just really, we're desperate. We're desperate for the
That's
help and
exactly what I was about to say. It's
understand.
desperation. Yeah,
Yeah. Yeah. Because
absolutely.
we're not getting answers anymore.
Hmm.
Right. And, like my notes say, like, we try these band-aid approaches.
Yes.
And a lot of times we don't even try them long enough, which is why the pantry has half full bottles of them, right?
Yes.
We did it for a few days or a week. We didn't see that change, but really we have to remember that a hormone shift, it's a whole 28-day cycle. It's different every day. So you need
Right.
at least 3 cycles
Yeah.
of a change to start seeing that difference in your body because your brain has to fix it. Thyroid, adrenals, and ovaries have to come online. So that's the other frustrating part, right? It's like,
Yes.
oh my gosh, this is going to take a while to get on board.
Yeah.
So we need that support as we
Yeah.
go,
People think I'm just going to take it and tomorrow I'll feel better. It's unfortunately not the case.
right? And I think that's really what's missing from the approaches that are being handled. So we have like traditional medicine. So you go to your OB-GYN and it's, hey, I don't feel good. And most of them are going to say, here's some birth control. I don't know what you want me to do for you. And then a lot of my clients will end up going to these, oh my gosh, there's 5 all across the street. They're all grouped on the highway near us of these hormone replacement,
Mm. Yeah.
right? And there's the men's one and the women's one. They have the big Jeeps outside. And they run some basic labs and they convince everybody they need these hormone injections. And I'm like, but you have lupus, but you have the Hashimoto's, but you have all of these other things going on. And they come back, they said, oh, well, they told me that you were wrong, Allison,
Of
and I
course they did.
don't have lupus. And I'm like, so you're telling me plus your 15 other specialists were wrong and you shouldn't be on estrogen if you have lupus.
Right.
And it's so scary that sales are overriding medical knowledge.
Yeah.
And that's where a lot of women get, and men too. Men are no
Sure.
limits in this
Hmm.
physical change. And that's really what's missing from that approach is that hormone, like no help, birth control only, hormone only, or like, are we going to do full health? We got to look at
Yeah.
food, sleep, that movement, that hit exercises that you
Huge.
were doing that crushed it in your 30s. Not right now, right? You got a weighted vest, but you're not using it in the ways that's going to build bone growth,
Right.
muscle growth. So let's fine tune all that together.
Hmm.
And so nobody knows we're out here, I feel like, hey.
Agreed.
So that's why we're doing this talk because
Yes.
there is support out there. This is
Yeah.
what we're talking about. Okay.
Absolutely.
So our question, so for everybody who's listening now, we have built a program for our community, for our listeners, for our clients that you're going to get a full inside out, top down, bottom up program where you have both of us looking at you. And we're going to do a comprehensive plan. We're going to look at all these things together. And we want to start with comprehensive testing for people and really understand because a lot of women go and they're like, either labs are run, it's like, well, you're normal. There's no way to know if you're in perimenopause, or no, you can't have labs done. So we want to start with that comprehensive testing that can be done through insurance or super cheap through our co-op because we don't want to just use band-aid treatment and we don't want to just guess and assume like here's the cookie cutter mold because there isn't one.
No.
And that's what's so important for all of these changes.
Yep.
So how do you feel like testing has played a role in how you work with your clients, if at all?
Yeah. Oh, for sure. So I would say that what I tend to do is and we're going to do this with our program as well, say, what testing do you have? And so
Yeah.
I'll take any testing that's done, and then I will typically recommend, hey, go back and get this, and this. And I try to send people through their primary because that's who they have the relationship with. And I want them to keep that relationship. But then they come back to me and doctor won't do it. They ran 1 or 2 of them, but not all of them. And what I'm finding is, I mean, so a simple thing of a vitamin D. You're coming to me with fatigue. We're going to work on your sleep. We're going to work on your diet. We're going to work on your movement, stress management. But if your D is 20 something
Yeah.
and you're not replacing it, you're not going to feel better. But if I don't know that your D is 20 something, right? So I really like to have at least a few baselines to make sure that it's not a thyroid issue, it's not an iron issue, it's not a D issue, so kind of that rule out of other things. And then B, to be able to make sure I'm recommending the right options, right? So that's why I love having you involved, Allison, because one, I know I have somebody who is going to order the right labs, right? And assess them in the right way. We're not going to look at just what this normal range is from Quest Diagnostic, that is the range of all of the unhealthy people in our community,
Right.
right? Those ranges just say you're not dying, they don't say you're healthy.
Exactly.
So we want to look at things from an optimal perspective and get people feeling the best that they can. And so having you partnering with me and in the care for this person and this woman and them partnering as well, we can get a really good view of what's going on, what can we do, and again, it always comes back to what are you willing to do, right?
Right.
Because
Right.
if that we have to get it all in perspective of what are you wanting in your life and what are you able to do so that we can make sure that we give you a plan that makes sense for you.
Absolutely. And blood testing is so nuanced and people don't even realize it because you think, well, why can't I just have my vitamin D run? And why won't like my doctor look at that? And it's not necessarily the doctor's fault. A lot of times it's the insurance won't cover it. And all of these health organizations that run medical associations are changing the rules and changing what insurance will cover. So you might want your zinc and your red blood cells run, and all of these, minutia things that are really, really important. But unless there's something that you can code as a disease process, your insurance is not going to cover it. And that includes vitamin D and Bs. I've had
Mm-hmm.
people come back with $1,000 bill just for vitamin
Oh,
D.
yeah, yeah.
I can get it for like $8.
Right.
There's no reason. There's a reason people are making money, but there's no
Yes.
reason that consumers should be blindsided by this because it went from being covered to you better have some very serious disease going on. And it's a basic everyday thing. And if we're talking, one of the main complaints of peri is low back pain, knee pain, shoulder pain, that's directly correlated to vitamin D. And you could take all the turmeric in the world, all the
Yes.
pain medication, you can throw all this stuff at it. But if your vitamin D, all this stuff is not there, it's either not going to work or it's not going to stay long. And you're going to be stuck in another cycle of chasing,
Yeah.
which is what we don't want you to do.
Yeah, absolutely.
So in our program, we have the option of you can send us your labs. So that way you don't have to go back and get stuck one more time. Nobody wants to do that. We can use your insurance. So that way, if your testing is covered, we're not concerned there. You can always call and ask about codes and what lab they prefer you to go to. And then I have my cash co-op where we can get essentially a full yearly panel with full thyroid, full iron, full everything, plus hormones for around $100.
Yeah.
And I'll tell you what, when I did it through my insurance, it was about $800. So it does make a huge difference when we're saving money because we know testing gets really expensive. And then we also have the option of the Dutch test, which is a dried urine test that gets mailed to your house. You do it at home, send it back into the lab. They'll look at the output, all of the different progesterones, estrogens, DHEA, testosterone, cortisol, cortisone, the patterns throughout the day, which is really cool. So you're getting a big picture, not only of where's the hormone level at, but how is it moving through your body? How is it being processed? Are genetics at a play? Our liver is, or do we need to go somewhere deeper to look at hormones, which is really exciting. And that's optional. And we can get that also at a discounted price for our clients, which is great. And then the last thing I'll say about the Dutch is that, with peri, our hormones on a roller coaster every day, which is why we don't like to do labs because it could be here one day and tomorrow you wake up, you're rock bottom.
Yes.
So the Dutch will give you a 3-day test. So you can do it over a week and get a broader perspective of the hormones throughout the week instead of going, here's your one shot. I don't know what's going on. So we do have all these options, which is just so much fun to play with.
Yeah.
Okay. So let's talk, as we work through this program, we're going to do your intake form. We want to know like a little bit more about you when you get scheduled. We're going to talk a little bit like, do you need testing? Let's get that set up right away if you need to, so you're not waiting and sitting there going, great, I'll see you in 6 months or something like that. And we want to get you started with coaching and a plan as soon as possible, which is so important. So, Jen, in your perspective, why is coaching and talking with somebody throughout this process so important rather than just like, oh, here's your test, here's your protocol, good luck?
Yeah. Yeah. I mean, so I think that it comes down to a lot of it. Like, you know how it feels when you go to the doctor, you go to an appointment of any type, and you only have this like short time, and it's like you're trying to rush and get all these questions out, and then they tell you, you got to fix your diet and start exercising. And you go home and you're like, what does that mean? Right. So together, you and I we're going to do like this whole kind of lifestyle assessment in addition to the labs, right? What's the inside of your body telling us, and what can you tell us about what you're doing? And then we can look at different ways to tweak and manage some of those symptoms, get your on a more of a healthier track, looking at longevity. And it's not easy to put things in place, right? If it was, we'd all be doing it. So
Right.
with the coaching, you get an hour session, you get 4 sessions, an hour with me. We're going to talk about, how you're feeling, if anything that you've changed along the way, what's working, what's not working. We're going to look at what barriers are keeping you from being able to do the things that you want to do to get healthier. So, Allison, we would not have half empty supplement bottles anymore. We would say, how do we make sure that we get those supplements in every day so that we can see whether those are helping? Or, okay, you really want to start getting your 10 minutes of sun. What do we need to change so that we can get that in? And is the 10 minutes of sun the important thing, or is it getting to bed at the right time? So we can start to talk through these things, and it gets very personalized. We figure it out how it works for your life, which is going to be very different than the other person I'm coaching, right? So do a lot around stress management. That's a big piece of it as well. A little bit of breathing, checking in with each other. When you start to put a new thing in place, we're not going to say, eat this, work out this way, blah, blah, blah. It's not a plan that's structured that everybody's getting and we're just rolling out to 5,000 people. This is your plan, what's going to work for you, what your day looks like. And I'm not going to go tell you to lift exactly these weights, but we're going to figure out how to get weightlifting in if that's something you're open to. So I just think that the coaching just adds a whole nother layer of support, of relief that you're looking for because you're just in this state of confusion and overwhelm already. So let's take some of that pressure off of you.
Yeah. I might be a little opposite when we do our functional meeting. So when we do that deep dive into hormones and cellular health and maybe autoimmunity and all these nutritional factors as well, is kind of like, well, what are the options? What are the protocols? So I may give somebody like,
Yep.
here's your 12-week weightlifting program because you're a blood type O, you have access to the gym, you're already going, we need to fine tune this. Or actually, you need to slow down. And I'm going to give you a couple YouTube programs that are
Right.
free. Like, we love, and I know you do too, like, what
Yeah.
are the resources that we can give you in this? So it is specific, and you're not like, yeah, I was supposed to work out today, but man, I got lost and confused. Cool, let's talk about it.
Right.
Did you try what we talked about and it like you just didn't feel good, or was it too much time, not enough time? There's so many factors in everybody's individual life that,
Yeah.
for some clients, we've talked about, all right, Monday is dry brushing day. Tuesday
Mm,
is the red light day. Wednesday is the vibrations day, like breaking things up throughout the week. And some people love that. They're like, oh, I can stay on top of my things when they're broken down into pieces. And other people need like this is my self-care day. And I'm going to do everything on this one day because I have the time and the ability and I can commit. And both processes are beautiful and they work. And I'll tell you, I tell people this because I tend to be very authentic. But when I worked with a personal trainer and they were like, well, write down what you eat every day. I ate perfect that week.
Oh,
I was the best person ever. The second I didn't have that sheet, I was having Oreos and like I went off track a little bit. And so knowing that having that accountability with a group, with a team, where we're not shaming or judging, but you're going to go, hey, you know what? Someone is supporting me in this. And yeah, I want to make the most out of this program for me.
hmm
Okay, I'll have a few Oreos, not the whole sleeve.
yeah,
Yeah, that's what we want to do,
yeah.
right? So that
8 to 20.
accountability is so key and
Yeah,
crucial because we're so isolated and lonely in this process. And it just doesn't feel good to not feel good. And
yeah,
that's where, for me, when I don't feel good, everything goes to crap.
yep.
I don't want to eat. I don't want to take care of myself. And if we don't have someone going, hey, when we are down, how do we manage that? How do we bring you back up? How do we navigate these times when they're good, they're medium, and they're difficult? And that's where
Mm,
we're here for
yeah,
that support, which is just so, it's so lovely to see people walk through these changes, isn't it?
agreed. Yeah, I love it.
Whether it's a few weeks, a few months, sometimes years, but it's slow progression. And just over the time, you're like, wow, you're so different from when I met you a
Yep.
few weeks ago, a few months ago. Look at the changes you've made. And sometimes you don't feel it until someone goes, hey, I haven't heard you complain about
Yes.
that itchy ears for a few weeks. We're making progress.
Yes.
So that's why we're here to hold our hands together and show you that it's possible for sure.
Yep. Love it.
Um, because how do you help women stay motivated when they're not seeing results immediately? It's hard, right?
Yeah.
And we
Yeah.
need that support.
It is hard. And having someone remind you of, like you said, a change that they're seeing or that it is a process or just, just stick with it another day. Or, if you need to have a day of, oh my God, this is, I need to freak out a little bit, freak out. You know what I mean? Like with someone to support you in that. I had a client that she would text me and she's like, I just don't know when this and this. And I would remind her, you're in the hardest parts or you're in a harder portion of this, and it would just calm her to know,
Mhm.
oh, you're right, I will be coming out on the other side. Today's just a hard day, so we'll definitely be there to do that as well.
Yeah, absolutely. Okay, so let's talk about our program a little bit. So we decided to team up because we wanted to offer the best of all the worlds from
Yes.
testing and all the options with testing and doing deep dives into functional medicine and bridging it into the coaching world and giving you that support and space and also following up with labs and making sure changes are being made and you're seeing the difference, whether it's your thyroid or your cholesterol levels or whatever inflammation markers are huge. Let's make sure that this whole process is is working. We know it will.
Yeah.
We're going to do that for you.
Yeah, absolutely.
So how does it look like for us to collaborate for people behind the scenes?
Yeah, so I think that, I mean, the easy answer is that you and I are very much in touch. But what will happen is, if you decide you want to be you want to do the program, we'll send you an intake form, and then Alice and I will review that together. We'll make some conversation about what do we want to do for next steps. Get in touch with you, and then Allison and I will be in conversation through the whole time, the 90 days. We will be in conversation with the clients as well. Obviously, I'll be doing my coaching sessions. I will check in with you if there's any additional questions that they have. You'll be helping them with the lab evaluation. You have a free kit that you're offering up that also is kind of a kickstart to get them feeling amazing. So that's a really great addition to this. Um, I think it's really a good program for obviously women in perimenopause, but I think that women who are through perimenopause could also get some benefit because, especially if they didn't have that help getting through it, just because you're on the other side doesn't mean you're not still experiencing symptoms. So it's really about anybody who's still just kind of like, what is going on in my body?
Yeah, absolutely. And it makes sense that we're able to collaborate on the work and understanding the symptoms, and especially if something new shows up. And that can be, like you
Yes.
said, whether, we have bad days, but what if there's a flare that happens?
Hmm.
Or maybe you overdid it, or, something changes in your life. We're there to communicate and support you and figure it out together, which is just so cool.
Yeah.
So, yeah, so like you said, also that we have that jumpstart kit, because I know that there's that bridge of time from scheduling to labs to getting, coaching, and you're going to get a starter kit with my foundational program, which includes Clary Calm as an oil that helps support brain, thyroid, adrenal, and ovary function, then fiber and liver support. And it's just really going to give you that bridge until final decisions are made and we know exactly what we're going to do. So, yeah, we do have protocols that work
Sure.
pretty well for everybody. But at the same time, you're not left hanging. And you're not going to be left hanging in this program
Never.
for long. Like, once you get started and we have everything, we're going to talk to you that week.
Yeah.
Like, we're not going to push you out for months. So we're with you, and we're going to be able to support you as all these changes happen. So we've talked about, what's included. So um, consultations, the kits included. Labs will be separate just because some people want to use insurance, some people want to use cash, some people have already had that done. So we didn't want to create a mess. Like, we'll keep that separate for you to make it a little bit easier. And this is perfect for people and women who are concerned that they're entering peri. Maybe they don't have all the symptoms there, but they're like, yeah, something's starting. So let's make sure your body is ready to go. Maybe you're in the throes of it and you have all of the symptoms and nothing's working. This is where we got you. And maybe you're postmenopausal, but maybe you're just feeling the sleep issues haven't come back better, right? Maybe
Right.
you're still having that brain fog. Maybe your libido is still down and you're wondering, well, I thought it would come back once everything normalized. And we can support you through all the phases with
Yeah.
that as well. So that's really exciting. Okay. Um, what makes our program different from anything else out there? I love
Oh,
this question.
I do too. I mean, obviously, a collaboration. You've got a nurse and a doctor there to help you, not just in the 1 hour, 15-minute session that you have, and for the full 90 days of support. The 90 days, like you were talking before, like it takes some time to see changes, and especially if you're doing supplements, but even if it's a workout or diet change or whatever, it's going to take some time to see what is really kicking in. So we don't just throw you out there and say, hey, or go do this, and maybe I'll see you, maybe I won't. We really do just kind of hang out, support, and figure out what, and then at the end, give you some ideas of how to continue this on your own. I think that's a
Mhm.
really big piece of it too, is right. Sure, you get some new habits and you start feeling better, but how easy is it to do a diet for a couple of weeks and then stop it? It's the keeping it going thing, and we'll make sure to give you some ideas on how to make sure that you can continue feeling better. It's not you need us for the rest of your life.
Absolutely.
Yeah.
Absolutely. And I think the biggest thing that makes us different too is that our our approach to everyone that we work with is a collaboration. And we know that the work is on the patient, it's on you, it's on the
Right.
client, right? And that that is the hardest part, which is why the coaching and support is so important. But at the same time, you can come to us and say, hey, what about? I saw this test. Do you think I need this? Or, hey, this company is offering this thing. Should I do this? And we can talk about it and evaluate it and say, yes, this absolutely makes sense for you. Let's do this. Let's get it ordered. Like you said, if you can't go to the doctor and they're going to order everything,
Right.
let's make sure that you're getting the information that you need to feel supported. Not everybody needs genetic testing, but if we can get that for you in the way that's going to be supportive and you want it, I'm open to it. Let's just make sure that it's right for you. So it's really great to be able to bring people questions who are going to be able to walk you through why not, the cost, what outcomes you can expect from that.
Yeah.
And that way you're still not like flailing around on the internet by yourself.
Right.
We're here for you. We're here
Yes.
to answer those hard
Come to
questions.
us first. Yeah.
Come to us first. Absolutely, because you're not alone. No one should be alone in this.
Agree.
Okay. So, how do our listeners and friends schedule our consultations?
Yeah. So can drop the website into the comments, and you would sign up for the program. And what that's going to do is it'll ask you to choose a date, and you're just choosing a date to hold your spot. You'll pay the amount that you see there for the full program. It's a one-time fee. And then, like Allison said, if you need more labs, that'll come later. And then what will happen is you'll get an email and ask you to fill out the intake form. And then one of either Allison or I will be in touch with you to then actually schedule when we're going to talk, what we want you to do as far as labs and how we'll get started. So the initial is just getting you saying, yep, I want to try this, and getting us started, and then finding out what labs do you need. So if you have, if you sign up and you have labs, you'll get some information about to send that to me so that we can review it and see what else we need. So it's pretty simple to get started. If you have questions and you're just still not sure, obviously we can, you can DM us. We both have free consultations on our website that it can be about that conversation, just to say, hey, is this for me? Is this not for me? I'm not really sure. Like, that's not a problem if you're just kind of still trying to figure out whether this is a good fit for you or not.
Right, right. Perfect. And yeah, you have access to us once you hit that go button and you're scheduled. And the intake form says, do you want me to email you, call you, text you? Like, we're going to make it easy for you to get in contact with us too.
Yes.
So, message us on Facebook here, Instagram. Like you said, our websites have contact buttons and forms. We'll drop our emails. Like, we're here. We're here. You'll find us.
Yes.
So if you're listening to this, whether you're live with us, just drop an emoji in the comments if you're resonating with any of these symptoms. If you've ever been told like, oh, this is just part of aging, you just got to deal with it. Like you'll be fine once you hit 50. Like, let us know what you're hearing and what you're being told. Or, maybe there's a symptom that caught you off guard, like the itchy ears or the burning mouth syndrome is
Mm.
another one
Yeah,
that we
it's
see
another
so
one.
often, and not relating that to the shift in hormones and inflammation in the body. So, and if you have any questions, especially around like hormone testing, what should be done, if there's debates around saliva versus Dutch that you want to talk about, we're here for it too. So thank you so much for hopping on today
Yeah, thanks for
with
dealing with
us.
our technical issues in the beginning. That was amazing. That's
Oh,
always
yeah,
fun.
always a lot of fun to deal with that. Okay, and I see you dropped everything in the live here for
Yeah,
us, and then we'll
just
add that to the description too. So we can get you started, get you supported, get you the labs done that you need, and get you supported. I'm going to say supported one more time.
support, support, support.
Support, support, support. Yeah, so you're not alone on this journey. I'll walk you through it. Awesome. Okay.
Amazing. Thanks so much, Allison. Thank you for listening.